do I know if my perineum is tight? In this video, I will talk about what the symptoms of tight perineum are like, what are the top 2 myth contributors, and what to do about it. Symptoms are golf ball tightness in the perineum, pain in the vulva or the shaft of the penis. It can be tension or heaviness around the anus, middle of the perineum, or around the penis or vulva. You can have pulling sensation from the inside of the pelvis, around the genitals and or anus, painful sex during or after with ejaculation. You can have itchiness in the perineum. You can have achiness, throbbing, sharp pain in the perineal region, which can radiate to the pelvic floor, lower abdomen, and lower back. You can have constipation. You can have urinary frequency, urgency, or difficulty starting or stopping your urination. The top 2 habits, in my opinion, that contribute to this are masturbation frequency and the positioning during intercourse, not intercourse, during masturbation, which blocks that pelvic thrust that would otherwise be seen with a normal intercourse positioning. The workouts in men and sitting in general heavily contribute to all of these symptoms as well. Now, what can we do about it? We have to look to see how these habits with all these signs and symptoms have come about. They are as a result of dysfunctional patterns of movement. Your body parts know exactly what their jobs are if they're allowed, if they're given the chance and the opportunity to stay with the plan. When you end up with dysfunctional patterns of movement, you pull body parts into the pictures, into the movements that are not innately their job. So you tweak the mechanics of movement, you change that blueprint of movement, and as a result of that, you start creating imbalances in your muscular tonicity, in your muscle tension, in the muscle strength, and in your body's overall movement. These are things that don't necessarily cause any pain at the point of start, and they end up being little aches and pains here and there that majority of people ignore until in men it involves their penis. Now all of a sudden it's emergency 911. And in women, we tend to usually ignore if it's that, or we just don't think about it. It's so easy to just blame the age or who knows what other things. These are all excuses that I'm bringing to your attention. And the reality of it is, as soon as you change those dysfunctional patterns of movement into functional patterns of movement based on the blueprint of movement, which we know of by studying human babies, then all of these will reverse themselves. Now, as a biomechanical specialist, which I am, I treat everything that has to do with biomechanics. Pelvic floor dysfunction is a biomechanical fault that comes with different shapes and forms and symptoms. So that chronic lower back pain that you might have, that chronic SI joint pain, those chronic issues that in your mind had nothing to do with your external genitals, your vulva, your penis or testicles or whatever, are actually related. So if you have any questions related to this issue, make sure you put them at the comment, as a comment down in this video. I will review them and I'll make sure I do more videos answering those questions. If you have not liked and subscribed to the channel, please do so. Please share this with other people. I know most people don't talk about these things, but there's a lot more people than you realize with this problem. Thank you for watching, and until next time, take care.